Dear colleagues, my name is Pieter van de Kerkhof. I'm a professor of dermatology at Radboud University Nijmegen Medical Center, where I hold actually a role as senior professor emeritus in dermatology. I have been for about 30 years chair of the academic department there. And now I'm serving actually to various organizations. For example, I'm Chief Medical Officer of the International Psoriasis Council, but also I am giving continuing medical education for societies in dermatology and also sometimes do some advisory work and give talks for companies in dermatology. And I'm ever so happy to give you the introductions now to the TalkMED organized report on AAD 2026 meeting. It's a pleasure to welcome you for this educational event around AAD 2026. TalkMED has prepared an overview of interviews with leading experts, and they will tell you the cutting-edge developments at AAD 2026. The AAD 2026, which is a huge, important American and international congress where the most recent developments in different diseases of the skin are presented. There will be an accent on the developments in skin cancer. Skin cancer is so important that dermatologists do early recognition and adequate treatment. We have the classical treatments for this, but also there are important developments in medications for advanced cases of cancer. Furthermore, it is important that we pay attention to prevention of skin cancer, early recognition of skin cancers, especially in high-risk groups. Do screenings in patients who are on chronic immunosuppressive treatments, especially when they have had in the past an exposure to ultraviolet radiation. And in inflammatory skin diseases, psoriasis, hidradenitis suppurativa, atopic dermatitis, but also in the more seldom inflammatory skin diseases, there are new developments in targeted treatments. New treatments available for the management of psoriasis, for example, but also new treatments available for HS, atopic dermatitis, new treatments available for pyoderma gangrenosum. But how to use these new treatments in practice? It is not about a quick fix. It is about a long-term maintenance in these treatments. And the long-term approach is important here. What also is important is the learning in psoriasis, which also probably is true for other diseases of the skin, and that's early intervention. Early active intervention to prevent a more serious, severe course of psoriasis. Early intervention in psoriasis decreases the number of tissue-resident memory cells in the lesions. And that means that you can prevent a more serious course of the disease. So early intervention in order to have a long-term true disease modification. So the presentations will be cutting-edge new developments of new treatments which are coming available, but also the adequate use of these new treatments. And the adequate use is early diagnosis, early intervention in order to have a long-term maintenance. I wish you a lot of learnings in this production by TalkMED for you. Thank you.